Okay, well, I want to officially welcome you. As Professor Bassow told you, I'm the Associate Dean for Undergraduate Studies in the Journalism School. So on behalf of the faculty and staff, I want to welcome you to this campaign's class presentation. It's always a really exciting time. Even though you're stressed, it's still exciting when you present the results of your hard work. So our students tonight are going to show the culmination of months of work for our client, the Lawrence Douglas County Health Department. The Health Department asked students to identify strategies to communicate its role in improving health and quality of life for Douglas County residents. So tonight we're going to hear students' ideas about how people in Douglas County can live healthier lives. Now, some of you know or may not know, health communications is something that's very near and dear to my heart because I spent about 15 years of my career working in health communications. I know it's something that Professor Bassow is personally interested in, and I think both of us would tell you that in health communication, you really can see how messages make a difference in people's lives. It can change attitudes, it can change values, it can change behaviors, and in effect change quality of life. So before we hear the presentations, and I know y'all are ready, and I see you're tense, just bear with me a minute, because I have to thank a lot of people. And first, I want to acknowledge and thank you students for your time and your energy and your commitment, because in the past month, and you may not know this, they've crisscrossed the country to do research for this project, and they visited health departments near and far. Some were close by in Kansas City and Tulsa, others were farther away. To complete the semester's research for this project, they've traveled to Kane County, Illinois, Ottawa County, Michigan, Spokane, Washington, Billings, Montana, Austin, Texas, home of the hipsters, and Phoenix, Arizona. In addition, students have traveled to Washington, D.C. to talk with staff at the National Association of County and City Health Officials. So you have worked really hard this past semester, but that work actually began years ago. To get to this class, which is our capstone course for strategic communications, you had to take courses in message development, in research, in writing, and ethics. Some of you took 101 with me. And in this class, you're going to put together everything you've learned and showcase the knowledge and skills you've acquired. So I know the past semester's been busy, and not a lot of sleep, lots of worrying, maybe a lot of French fries or chocolate, and almost overwhelming at times. But tonight, it all comes together, and you present the great work that you've done. And there's an African proverb, and some of you know that that's where I spent most of my health communications work, is that if you go fast, you want to go alone. If you want to go far, you work together. So tonight, you all are putting all that togetherness up here so we can all see it, and you've created messages that are practical and that your clients can use. I want to say a special welcome and thank you to our client, the Lawrence Douglas County Health Department. We recognize that your mission is to help us. You want all of us to stay well, and you do that by providing services and programs that really aim to prevent problems before they start. You focus on wellness, both physical and mental, and you provide education, you conduct research, you develop policies, you build partnerships, and our community is truly fortunate to have you as a resource. And we're also very fortunate and grateful that our students have had you as a resource to help them learn more. I know that you've worked closely with Dan Partridge, the department director, Charlotte Martholer, the associate director, and Carrie Britt, the communications director, and thank you very much for working with the students. You've also worked with Colleen Hill, Jenny Hanault, the health department, and health department board members, David Ambler, Maylee Wilkins, Dr. Douglas DeCaro, Dr. Kevin Stevers. So thank you all very much for working with students too. You've given our students an important opportunity to sharpen their skills, and we very much appreciate this. What you may not know is that the students' work here tonight is part of a much, much larger effort within the journalism school with a focus on building healthy communities. And in fact, if you look at KU's website, we have 4 goals under KU's Bold Aspirations, our strategic plan, and one of those is building healthy communities. In the journalism school, there are several efforts underway to show the link between clear and accurate communication and healthy behaviors. The journalism school is home to the Center for Excellence in Health Communications to Underserved Populations, CHECUP for short. And CHECUP works to examine communication about health promotion and disease prevention to at-risk populations locally, nationally, and internationally. At Checkup, KU faculty are working on a variety of projects, including research on diabetes among Native Americans in Kansas, and community health workers and their efforts to combat dengue fever in Costa Rica. In addition, Checkup is working on projects that look at how radio messages have informed rural communities about cancer clinical trials, how Latinos in Kansas City use the internet for health communication, how media affect young people's use of alcohol and tobacco, young people and obesity, how the media report on post-traumatic stress, and how journalists cope with covering trauma. In addition, we've offered health writing courses, and this has brought together students from the journalism school, but also other departments, including the med school and engineering. So finally tonight, I want to say a very special thank you and welcome to our students' parents, your friends, your family, your guests. I was a student for a very, 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 very long time, and I know that success in college is a team effort. Even your pets can help you out. We know that your help and your support and your love have been invaluable in getting students to this point, and it's going to be invaluable in getting students into their careers. Now, people often ask, do clients really use what students recommend? And I think after you see the presentations, you will say, well, why not? And the answer is, of course they do. The goal in this class is to give students practical, real-world experience, and clients often implement students' work. Our dean is fond of saying that clients make a wise investment by working with the campaigns classes, because after these students graduate, they're going to have to pay a lot more for the services. So campaign students' challenge here has been to identify a need and then produce a broad range of research-supported conclusions so that the client can see several solutions and understand the communication issues more clearly. You'll see in tonight's presentation that students' work is going to focus on how clients can use communication effectively to inform the public about valuable services. You should know that students in this class can earn credits from KU's Center for Civic and Social Responsibility, and this course enables students to work toward a certificate in service learning. So the campaigns class is an excellent example of a project that allows students to learn by doing. What students learn not only benefits them, but also KU, Lawrence, and our broader community. So the work they do truly has an impact. Now, how many of you are going to graduate this semester? Okay, some of you, and some of you in May. So for many of you, this is kind of your last major journalism project. And you're probably thinking it took forever, but those of you I remember from 101, it was just like that. It just went so fast. But it's a project that is really going to help you in your future careers. When I meet with alums, one of the things they often tell me is how important the campaigns class was to them. We have an alum who still remembers his client 30 years later. Alums also tell me that their bosses are really impressed that students have developed such comprehensive projects, and colleagues are kind of envious because they didn't have the same training to put on their resumes when they sought jobs. So for all of you wondering, yeah, this is going to translate into a job. Okay. So I appreciate everybody taking time to come to this class presentation. It's a cold night. We all could be like watching, I don't know, Say Yes to the Dress or something, but we're here instead, and your presence means a great deal to the students. Now finally, I want to thank Professor Bob Bassow, who's the instructor for the campaigns class and has led the group in this project. But I realize instructor doesn't really accurately describe what he did. I think it's more like coordinator, advisor, ringmaster. In movies they have a director of continuity. I think he fills that role. So for now, I want to thank you all for being here and for all your work, and I want to introduce or reintroduce Professor Bassow and let the students begin their work.